heart of Mumias West Sub-County stands St. Mary's Mission Hospital, a faith-based Level 4 teaching and referral hospital with a rich history of quality healthcare provision spanning 88 years.
It was started in 1932 as a dispensary, and now it's a teaching referral hospital in the sub-county. It is located 1.6 kilometers from Mumias town, the center of District Kakamega County and Western Province.
Strategic location gives the health facility good road linkages to Kakamega, Bungoma, Busia, Siaya and Vihiga counties, making it accessible to the entire western region stretching into the vast eastern parts of Uganda.
It offers 24-hour outpatient and inpatient services with an average workload of 5,000 patients. It has a bed capacity of 255 and another bed capacity of 19 at the renal unit and 25 bed capacity at the newborn unit.
In the whole of Mumias, we are the referral hospital. All the other facilities around us in the catchment area bring their patients here. Just to name a few, Butere, we have Bungoma. They come as far as even Bungoma. We have Matungu. We have several. I have up to around 33 of them that refer their patients to me. And they bring to us mothers in labor. Other patients come, yes, but in most cases we are doing more of the maternity. And we have worked together with several other partners. We are not alone. We have the KCCB, who are also assisting us in many things, like supporting us through buying of machines, introducing other projects. And on such, we have like eye care, which was introduced to us by Nawiri. And it's doing very well, whereby the whole essence of it is we want to have a one-stop for all these patients.
The hospital ownership and management by the Congregation of the Sisters of Mary of Kakamega confers a Catholic identity embedded in the healing ministry of Christ.
This being a mission or a faith-based hospital, we have the diocesan bishop who is the owner of this facility, since it's in a diocesan facility. We have the governing board, which reports to the diocesan bishop. We have the hospital administrator, who reports to the governing board. And then we have the hospital chaplain. We have the medical officer in charge, that's stroke lab director. We have the human resource manager. We have the senior accountant. We have the HSL, that's quality manager for under the CCC. We have the nursing officer in charge. And then we have the principal, School of Clinical Medicine.
What I like mostly about the Catholic aspect is they nurture and employ both spiritually, and they are there for the employee holistically, and it doesn't matter where you come from or whom you are, they always incorporate you, and they're able to help you be able to exercise, knowing that as much as you're touching somebody's life, you are touching somehow, you're in the service of Lord.
The dire need for quality, reliable healthcare in this majorly agricultural region led to the birth of this medical center to provide curative and preventive healthcare services to all people within and beyond this catchment area.
Faith-based facility. The hospital has 255-bed capacity. And has also opened recently a renal unit of 19-bed capacity and a new neonatal newborn unit of 25-bed capacity. The hospital operates 24/7 and has a wide range of health services given to a catchment population of about 40,000 people.
St. Mary's Hospital has several integrated units coupled with effective leadership and governance structures that work jointly to ensure the services delivered are ultra-modern, effective and affordable to all.
We have the governing board that reports to the diocesan bishop. We have the hospital administrator who reports to the board of management, the governing board of the facility. We have the medical officer in charge, who is also the lab director. We have the human resource manager. We have the senior accountant. We have the HSL quality manager working at the CCC. We have the nursing officer in charge and the principal school of clinical medicine who report to the hospital administrator. At the same time, the principal school of clinical medicine reports to the governing board, who in turn reports to the diocesan bishop.
Our outpatient specialized clinics include surgical services, gynecological services, pediatric and orthopedic, ENT, dental care services, dermatological and the renal dialysis services.
Our outpatient general services include the casualty, the consultation and treatment, the maternity child health care services, the nutritional care, laboratory services, physiotherapy, pharmacy services. We have the imaging, comprehensive care clinic, that's stroke family health. We have the epileptic care. We have the sickle cell care. And then we have the diabetic care, also found at the outpatient.
The hospital is setting a benchmark for specialized healthcare with its highly developed and capacious renal unit in the entire Western region.
Our hospital has 7 departments. We have male medical, female medical, we have surgical ward, we have the renal unit. And if I talk about the renal unit was introduced, opened last year, March in 2022. And we've done very well because the numbers or data does not cheat. Right now I have 24 serious patients that we are treating, and we have 10 machines of the dialysis. So we make arrangements on how they will come in so that they are not all coming and overstaying on the online.
We also have the dialysis area, that's the renal unit, which takes care of our patients for dialysis processes and services. At the moment, we have 18 clients for dialysis who come in on daily basis. They are grouped in groups. They come in groups. There are those for Mondays, those for Wednesdays, and those coming in on Fridays. And any other day that maybe one may have missed because of other issues, the patient can come in any other day and is served well at the renal unit.
Over the years, St. Mary's Hospital Mumias has proved to be a center of excellence in maternity care and the postnatal, maternal and child health care.
Our mothers preferring to come to the facility, even if they are being taken elsewhere, they will prefer to come to St. Mary's Mission Hospital because their care is up to date. There is qualified staff for the maternity wing. We have the gynecologist who is always there with our mothers to ensure that they are taken care of well. Their babies are also taken care of well. And this makes our hospital to be well known around and far as the best place to bring mothers for their delivery.
I am from Kakamega County. and I stay in Lurambi. Napenda sana St. Mary's Hospital because it has done great, so much great in my life. I always come from Kakamega to Mumias, St. Mary's Mumias for clinics. Na tangu nikwe ujauzito wamenisaidia sana mpaka saizi nimejifungua. Nikianza clinic zangu nilikuwa na cyst na zilikuwa kubwa sana kushinda mtoto. Lakini namshukuru gynecologist wa St. Mary's na madaktari kwa maana walinisaidia hadi zikapungua na zikaisha zikapotea kabisa na nikabeba ujauzito wangu. Wamekuwa na mimi mpaka saizi. Nilikuja nikiumwa lakini wamenisaidia sana through nilienda CS jana wakanisaidia nimepata mtoto wangu kijana.
The hospital has a newborn unit with a 25-bed capacity, fully fledged to offer specialized nursing and monitoring preterm, underweight and babies with afterbirth complications.
For the last 5 years, I have seen this hospital growing exponentially, given the fact that we have recently opened a renal unit. We also maintained accreditation, and our mortality rate in maternal child care services is the lowest within the county, and the hospital is looking forward to put in place a maternity complex that will give more comprehensive care to the mother and child.
The doctors are very friendly and they help when they see you need help. Wanakuongelesha to make you happy even when you are in pain, unajipata umecheka. Nakumbuka hata mimi nikiumwa, they used to say siko in pain because they used to make me laugh, and I just laugh and I smile until the end of my journey. So everyone who is out there, I really request you to come to St. Mary's Hospital because it is the best hospital I've ever been in Kakamega County.
Before saying, we are looking forward to making it a complex whereby a mother comes in from conception, she will get all the care from antenatal ward, antenatal care. She goes intrapartum care, she will go through postpartum care and come out with the best quality of a mother and a baby.
The maternity docket collaborates with several other government and private initiatives that seek to support mothers through antenatal and postpartum care, including Linda Mama, Boresha Jamii, and Mom Care Kenya programs.
Linda Mama, which has supported the mothers very well because there are those mothers who cannot even afford to pay for their NHIF. And then we also have another project called Mom Care. And in Mom Care and Linda Mama, I just say thank you God we have been given this opportunity. If the mothers are going to use this opportunity, they get to us as early as 22 weeks below. Anytime a patient conceives, you come immediately, you are registered with Linda Mama. Why? And then we are also registered with the Mom Care. There are two different things. Linda Mama will take care of this patient up to delivery. As they go home, they now take up their own responsibility of their babies. But for Mom Care, when you come before 22 weeks, we register you for Mom Care. Mom Care will continue following you. They even have staff on their own who will continue following on your care as from the time of conception to the time of delivery. And as I said, we need care, quality care. If you have a quality care, then I'll have the best outcome. I'll have a healthy mother and a healthy baby.
With a Class A ISO certified laboratory equipped with leading-edge diagnostic and therapeutic medical apparatus, the center performs numerous specimen tests within the shortest turnaround time.
Our core values are encapsulated in the acronym PREDICT, that is professionalism, respect, efficiency, dignity, integrity, collaboration, and time.
The pharmacy unit receives sufficient supply of drugs and regimens from the Mission for Essential Drugs and Supplies meds, as well as other ascribed suppliers to ensure timely prescriptions to patients.
Our pharmacy departments procure drugs from accredited suppliers like meds, which is our main supplier.
We have professional development and trainings through continuous quality improvement. We have the internal CMEs, that's continuous medical education to our staff, to ensure that our staff are updated to be able to carry out their duties and functions or render their services in a proper manner. We also have a steady supply of drugs and non-pharmaceuticals and reagents from our partners, that's meds.
The hospital has spacious ward units and amenities that provide a conducive environment for effective inpatient care to adults and children. These include general wards, surgical and specialized treatment facilities.
We have the male general ward, the female general ward, the maternity ward, and the newborn unit. We have the pediatrics ward, the surgical male and female ward. We have the semi-private ward. We have the amenity ward and the isolation ward, which is now working as a center of diabetic patients.
The amenity ward provides extra treatment units designed and designated to satisfy patient comfort and private needs.
We also have the corporate clinics, whereby we don't allow our clients who are coming in for specialized clinics to queue at the outpatient. They are taken in to their various corporate clinics for their services. This makes them come in because they feel the time taken to assess them, to render them services required, is minimal.
St. Mary's Hospital Mumias is renowned for its capacious, well-furnished theatre with time-served specialists performing both minor and major surgeries round the clock.
All the other referring facilities bring the patients to us in most cases because of the theatre. The theatre is 24/7. The doctors who are there are very competent. We have MOH that will go there, and then we have a gynecologist on the ground. In fact, the whole reason why you should be in St. Mary's. She's a resident gynecologist. She will see you. She will see if there are any issues. And if the MOs find that they have any issues, they usually refer to her the issues, and she comes on the ground. Even at night, she will come.
We have our average annual patient attendance of around 10,532 and outpatient attendance annually at 67,927.
The healthcare facility is accredited by the Nursing Council of Kenya and the Kenya Medical Practitioners and Dentists Council KMPDC as an internship placement facility for medical and nursing degrees.
You'll meet very qualified, well-skilled nurses who are able to give you the best that you need. So they'll register you, take you to the wards. And within the outpatient, we have clinical officers, we have medical officers. I have like 7 medical officers and so many clinicians. And having been told that it's also a training institution, you'll also get some students for clinical medicine, for nursing, from various facilities around.
Resident experts at St. Mary's Mission Hospital work closely with visiting medical consultants and specialists, including general surgeons, ophthalmologists, dermatologists, and nephrologists, to render specialized treatment services to patients.
We also have consultants, and the hospital has gone an extra mile of having a resident general surgeon, a resident obstetric and gynecologist who run their specialized clinic throughout the week. And that has brought in much more confidence and increased our numbers in terms of service delivery to our catchment population.
The hospital administration has established solid partnership with the National Health Insurance Fund (NHIF) and various private insurance agencies, which has opened St. Mary's Hospital doors to more categories of patients.
The insurances that we accept in St. Mary's are not limited, but number one, we are NHIF accredited. Other special insurances, we have Jubilee Insurance, AAR. We have a special program for mother and child. It's called a mom care product. It's NGO facilitated, which registers mothers who are expectant up to 22 weeks. Then we have Jubilee Insurance, KDF, amongst others.
In a quest to ensure access to quality inpatient and outpatient healthcare by all people at little or no cost at all, the hospital is open for more partnerships with other available health insurance providers.
St. Mary's Mission Hospital is a mission hospital whereby we make sure that we only consume what we've spent and we don't generate profit from whatever service we are offering. We are a service industry that is purely service to the nation.
The medical staff prioritize patients' health stability and recovery strides, which continues to spiral up patient visits to the facility.
We have our average annual patient attendance of around 10,532 and outpatient attendance annually at 67,927.
Michael Nalwanga, a resident of Marama North in Butere Sub-County, attests to the swift surgical intervention he received that has since proved effective in his journey to recovery.
Nilikuja hapa, nilikuwa nimefeel maumivu kutoka nyumbani na nikaletwa hapa kwa hali ya dharura haraka. Kama na tumbo ilikuwa imefura na sipumui, hata nilikuwa hata sina haja hata ya kula kitu.
My duty every morning is to make sure I'm reaching each and every patient. Unless I have a tight schedule, I'm reaching each and every patient to make sure I'm asking, mulilalaje? Tulilala vizuri sister. Wamehudumia vizuri? They say yes. Have you gotten your medication? Yes. Or one will not, okay, it can't be really perfect 100 to 100. One will tell you this happened. And when I get that, I get to the root who was on duty. I come to listen to her. She tells me this and this happens. So we correct them according to what is happening.
Wamenishughulikia mzuri. Hata nilikuwa naona mhudundu wa hapa alikuwa anatutembelea, kwa hivyo alikuwa ananiongezea nguvu na nikiamini ya kwamba mpaka nitapona.
This Mission Healthcare Center gives credence to spiritual nourishment through its pastoral docket set aside to take care of the spiritual and psychosocial welfare of both patients and staff under the superintendence of the hospital chaplain.
These patients are even more happier because of the chaplain we have. They are getting care, nourished care from Father. Father comes every morning, he will pray with them, give them hope, and even give sacraments to those who are getting, and just make a real prayer to them. And if there is any problem, they will tell you, and we refer to Father for counseling, though we also have a counselor. That is spiritual counseling, but we have a psychological counselor in the hospital who also helps in such.
We also carry out the training of our students. We have research, being a referral hospital and a training institution. We have students who come in for their research because of the various departments that we have.
The Digital Imaging Center offers efficient radiology services to an influx of both referral and non-referral health cases.
Most of the times we receive clients who have had injuries, road accidents, and they would prefer to come to St. Mary's because there is the X-ray units there, the imaging is up to date. And so when they come in, they are taken care of as they are taken as an emergency to be checked and to see the proper intervention around their injuries.
With enough paramedics on standby and 24-hour ambulance services, St. Mary's Hospital team is always geared up to respond to accident and emergency referral cases with the required urgency.
We are also working together with Jacaranda, where we have flare rescue team. The ambulances have been put in the society, in the community. So anytime a mother is laboring and would wish to reach to St. Mary's, they call the number of dispatch of flare, and flare dispatches them, and we get those patients on good time. St. Mary's is also lucky to partner with them because we have an ambulance which is also used to collect mothers even from the community to St. Mary's, and the whole reason why you should be in St. Mary's.
Hata kama uko mbali, they have an ambulance. You just call for emergency and then they come pick you wherever you are, and you'll reach safely and you'll get the services you want.
St. Mary's Hospital has established health networks and linkages with community members, including midwives and border operators, in a bid to set the seal on safe delivery for expectant mothers as it seeks to mitigate maternal mortality rate in this region.
We work together with the other community members. Who are they? The border. Sometimes those who do not know there is an ambulance number they can call, they are the people who bring them to us. We also work with the chiefs, we work with the sub-chiefs, and we call them CHVs, the community volunteers.
The hospital has been at the front line of anti-Jiga campaigns, community networking and linkages, home visits, youth empowerment projects, psychological counseling, and HIV/AIDS advocacy care and support programs.
We have community mobilization, community sensitization, community partnership, basic care, that's the mobile clinics, health education, which is done both in the community. We have the health promotion. We have school health education, which is carried out in our various schools around here. Mumias being a complex place. We have emergency response, and then we have contact tracing of lost to follow clinics. That's at the CCC.
The Comprehensive Care Clinic CCC provides holistic care to patients living with HIV/AIDS and to the at-risk groups who are susceptible to infection.
This area is on from Monday to Fridays, and our clients come in those who come in for the specific medication in that area, they are not exposed to other departments, but they go straight to the clinic. They receive their medication. If there is anything to be done, counseling, they are taken care of well by the qualified staff at that area.
The compassionate care offered at St. Mary's Mission Hospital, Mumias, continues to attract favorable feedback from clients and the surrounding local communities.
Every now and then, we encounter clients from the community coming in, giving us feedback on our services, on the care that they have received. Our staffs have high respect for our patients, whereby no staff has a right to mishandle a patient.
Mimi nawashukuru ni staff wote wa theater na madaktari wengine wote na nurses na wale wanajali vile tunalishwa kidogo. Mimi nawashukuru sana.
So many patients around have received help. Others have seen them being transferred from other different hospitals, big hospitals, to St. Mary's for help here at the maternity. And they are all well. They go home happy with their babies.
Many have vouched for the contribution of this mission health facility to sustainable development of the region, evidenced by employment opportunities and health education services rendered to community members.
Very many patients are very happy. They come back and say, my patient was dying, you people really helped me, and here is a cake for your staff. And we've had that in maternity 4 times, and amenity ward, that is a specialized ward. You know, people who come in specialized wards know their right and know what should be done. But most cases they have left saying, you are just up to task.
The hospital is tapping on the available viable opportunities for growth to improve quality standards and propel its wheels to the envisioned level of a leading teaching and referral mission hospital in the Western region.
We had an assessment, and with this assessment, we were given level 4, but we are working towards level 5, and this will ensure that we keep to our core values, we maintain our standards of service to our clients, and we ensure that each person's dignity is upheld.
St. Mary's Mission Hospital is soon opening an ICU with 6-bed capacity, and you are all welcome once it starts running.
We are all working towards one goal, to ensure that our staff, to ensure that our client, our patient, is well served, since that's the core of this hospital. Na waalika wamama wote, sana sana wale wajawazito, wafike hospitalini St. Mary's wapate huduma.
For more information and inquiries, contact us on 0789 712 382. You can alternatively email us on info@stmarysmissionhospitalmumias.org. St. Mary's Mission Hospital, Mumias.
We treat with care, God heals.